What are the benefits of seeing a chiropractor? Chiropractic care focuses on the health of the body, spine, joints, muscles, and nerve system. And chiropractic care can involve techniques using adjustments with the chiropractor's hands or instruments with the goal of improving the spine's alignment. And the spine vertebrae should be stacked on top of another in a straight and neutral position from the front, and from the side it should have smooth flowing curves. And optimal spine alignment is important for optimal nerve function. And optimal nerve function is important for overall body function because the body functions at the level which your nerve system functions at, meaning every function of your body is working because there are signals that are being sent from your brain down your spinal cord, out nerves to your body and back. And this cycle is how your body works. And therefore, a properly functioning spine equals a proper functioning body. Now, can chiropractors help with relieving back pain and other pain that's associated with the spine? And the truth is, yes, back pain can be addressed by chiropractors by helping improving something that we call spinal rigidity. Spinal rigidity occurs when the spine sits in a malposition and it starts to heal in this abnormal position, being fixed. And this is what we call spinal fixation or spinal rigidity. And this lack of range of motion can lead to inflammation and pain. So therefore, chiropractic care can work on improving the motion of these areas, and it can also help decrease nerve-related back pain, because as these bones start to press on nerves, this type of pain can be very debilitating, and chiropractic care can help reduce not only back stiffness and pain, but also can help reduce this nerve-related pain. A question I get asked a lot is, can chiropractic care help with disc issues? And many cases of disc issues are a result of spinal degeneration. And spinal degeneration typically results when the spine shifts out of alignment, and it remains that way for a period of time. As it sits there, it puts abnormal pressure between something called intervertebral discs. And discs sit in between two bones, acting like a cushion. They act for flexibility, they act like shock absorbers, and they help provide structure. The problem is, once the spine's misaligned for a significant period of time, this uneven pressure can cause uneven wear or tear, causing these discs to degenerate, get thinner, and they can herniate. And when they start degenerating, they can start leading to symptoms like lack of motion, nerve pain, and stiffness. Improving the alignment means taking pressure off these abnormal discs and allowing more symmetrical pressure. This can allow the disc to start to heal and function better, and this can encourage the disc inner nucleus to maintain in its central position and help the body recover from these types of problems. Now, one also question I get asked, what about more complex spinal conditions like thoracic kyphosis and scoliosis and hyperlordosis? Well, if we talk something like scoliosis or any type of spinal deformity, these are spinal conditions that can be relatively prevalent among the population, and this causes unnatural curvatures or shifting to occur within the body. And these unnatural curvatures typically twist and rotate into the concavity, and they can lead to more significant problems within the spine. Now, these curves or conditions can become so severe that you're treated with surgical options that require spinal fusion, which can be very, very risky. However, there's non-surgical conservative treatment options as well. Now, chiropractic care can be a center of this non-surgical treatment options for these more significant spinal deformities. However, it must be scoliosis-specific or structurally specific types of chiropractic care, not just general chiropractic. And the reason why is because a scoliotic spine has become more structurally misaligned and has led to something that we call spinal deformity. And therefore, trying to address the spinal deformity requires more than just general chiropractic adjusting. Normally requires a facet of many different treatments. But a chiropractic-centered treatment approach can impact scoliosis. And when I mean chiropractic-centered treatment approach, it means that the goal of the treatment is addressing the underlying structural nature of scoliosis. Chiropractors tend to focus on cause. We want to improve cause and improve function. So therefore, the goal of a chiropractic-centered scoliosis treatment is to really address the size of the curvature and make the spine straighter. Specific scoliosis chiropractic care involves working on the techniques and adjustments that can help reposition the spine and help the most tilted vertebra become less tilted and decrease rotation. However, chiropractic treatment can help reposition these vertebrae, but chiropractic care alone typically isn't enough to address scoliosis on every level. So many patients that experience symptoms from scoliosis may use chiropractic care as an effective treatment option to manage the symptoms, but normally we have to use it integrated with many other treatments to get the curve to actually reduce and get better, because that's the ultimate goal, is to improve the health, improve alignment, and improve function. So therefore, we call this a chiropractic center approach or a functional approach. However, there are other treatment options that we can add to just chiropractic care. One option to consider is obviously surgical treatment. Now, I call surgical treatment a non-functional approach because a surgical treatment is using hardware, screws, and rods to force the spine as straight as possible and eliminating all other functions of the spine like movement and flexibility. Now, non-surgical approaches are looking at not only reducing the size of the curve, but while maintaining function. And this is the key component here. Surgical treatments or surgery for scoliosis is a non-functional approach because it's just trying to force the spine straighter, where non-surgical treatments looks at a function of the spine, trying to reduce the size of the curve and improve function. Now, getting structural changes in the spine must be supported. So therefore, very often, not only do we use chiropractic care, but we use something called scoliosis-specific exercises. And these exercises are used in combination with chiropractic care to help strengthen the muscles and tissues that surround the spine. In addition, we will use scoliosis-specific physical therapy. This could be a combination of exercises, vibration, tractions to help move the spine and push the spine into a straighter position and help overcome some of the rigidity factors associated with scoliosis. Very often, we can also add something called corrective bracing. Now, corrective bracing can be used to help remodel the body into a more symmetrical position, and it can also help by pushing spines into a straighter alignment as well. And last thing we talk about is something called home rehabilitation. Home rehabilitation is trying to perform as much as we can do at home, like scoliosis exercises, like spine-friendly lifestyle exercises, and again, continued maybe maintenance chiropractic care to help stabilize the spine and the scoliotic spine from continuing to worsen. Now, as a chiropractor, I know that there is a lot of chiropractors that treat patients with scoliosis. However, as a chiropractor who focuses on scoliosis, that there's a very, very big difference of treating somebody with scoliosis versus treating someone's scoliosis. The regular benefits of seeing a chiropractor are very, very important, and they can help the spine stay strong and be flexible and more aligned. However, chiropractic care that's scoliosis specific typically involves combining chiropractic care with many other treatments to deliver a response to a scoliotic spine. In addition, patients that involve themselves with chiropractic care can typically improve a very wide number of complaints like injuries. They can manage progressive spinal problems, and they can also use chiropractic care as part of their scoliosis program. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.